According to the healthcare-related commitments made by the state administration during Governor Ademola Adeleke's inauguration on November 27, 2022, this was revealed during the press conference held in Osogbo to commemorate the UNIOSUN Teaching Hospital's one-year anniversary. The Chief Medical Director of UNIOSUN Teaching Hospital, Osogbo, Dr. Babatunde Afolabi, has called on government to take swift, decisive, and sustainable action to address the challenge of JAPA syndrome ravaging Nigeria health sector. Afolabi said that a year defined by bold reforms, visionary leadership, and transformative outcomes. Under his leadership, the hospital has seen major upgrade in clinical and infrastructural transformation.
At this level of 1 year, we were able to say Almighty God has been of great help to us. I want to say so far, the indebtedness of 108.5 million of IBDEC debt has been cleared, restoring and also giving us uninterrupted power supply. Now we have 18 hours energy supply. We also conduct facility-wide audits and staff consultations. I began renovations of wards, the theaters, administrative area. I want to say you just have to make a visit to some important areas in the hospital. Starting with the theater, the 4th theater has been well renovated. The ICU has been well renovated. Also, people now don't return patients from red line. We can't do surgery. We created what we call theater pharmacy, where drugs are readily made available. Patients go there to procure with the PAC system, and patients are being operated as and when due. Patients don't stay unduly on the wards, and that in itself has been of great help to us.
He acknowledged the consistent support of Osun State Governor Ademola Adeleke for his assistance to UNIOSUN teaching hospitals. He said staff welfare training and accreditation has restored morale and confidence with the hospital, and previously overlooked staff have been regularized. He said over 360 million grants and donation has been received with meaningful Nigeria. He reaffirmed his commitment in strengthening relationship with police, DSS, to improve institutional and public confidence in our people. In his remarks, he called on government, civil society to collaborate in rebuilding hope and resolve dignities to the medical profession.
Has regularized them and placed them where they should be. All of them, they have done so well by appreciating the excellency. In fact, they built a pavilion in front of the labor ward where patient relation now sits. You know, we can pray, do everything. They use their personal money, donating a cost of 6 million. To build that pavilion, well positioned for patients to use. So we want to give kudos to His Excellency. 407 have been promoted, as I said. The pension board has been released. Those who have served the state, those who have served here, they have released their pension board. 50% salary increment for contract staff. We are working on how to make these people on contract to be full-time. Since I came over, I have not appointed any contract staff apart from those people who we need in clinical services for their services. Allowances reviewed for doctors, for nurses, for consultants, and their call duties. And more than 25 people trained and workshop has been organized since I came. More than 25 plus has been organized. Open door policy is what I use. Encouraging feedback and also allowing for collaboration.
Kende Afolabi, Abntv News, Osun State, Nigeria.
ABN, celebrating Africa's rich cultural heritage.